afternoon, everyone. Welcome to Keeping You in the Know in 2025. As part of our Lynn Cancer Institute Survivorship series, today our presentation will be what every survivor needs to know about follow-up care. We're very grateful to have you all with us today and to learn from our amazing LCI nurse practitioner, Paige Acom. At the Lynn Cancer Institute, we believe that education and awareness for our patients, survivors, and their families and caregivers is so very helpful to all that they are going through as they go through their cancer process and journey into thriving beyond cancer. In the interest of time, Paige's bio was sent to you by email. And during her presentation, we invite you to please take notes. And if you have a question or a comment, please put it in the chat box or the Q&A, and she'll have time at the end of her presentation to respond to you. So we're happy to welcome you and to learn from Paige. Welcome, Paige.
Thank you, Jan. Thank you. Thank you, everyone, for joining. My name is Paige Acom. I'm going to go ahead and just share my screen here. So, my name is Paige Acom. Thank you, everyone, for joining. Good afternoon. I just wanted to quickly introduce myself. Like I said, my name is Paige. I'm a nurse practitioner here at the Lynn Cancer Institute and have been for about 2.5 years. Prior to being a nurse practitioner here at the Lynn Cancer Institute, I was a nurse here in the treatment room for about 5 years before I decided to further educate myself and become a nurse practitioner. I went to Nova Southeastern University, go Sharks, and I graduated with my master's in nursing as an adult gerontology acute care nurse practitioner. I've been with the Lynn Cancer Institute for about 7.5 years now, almost 8 years, and continue to grow with them and be a part of patients' care, hopefully empowering them. And today we're going to talk about what patients can do as survivors after going through a cancer diagnosis. So the title of my presentation is Thriving Beyond Cancer, because even though you might be a survivor, you technically have always been through this journey and you always have us as part of your team. So first, why does follow-up care matters? So it's really important that, God forbid, your cancer does reoccur, that it's caught early. And by ensuring that you come to your follow-up appointments and staying in contact with us and your team, those things can be detected as early as possible, therefore making your care that much better. And God forbid, if the cancer reoccurs, giving you a better chance of beating it yet again. Managing long-term treatment effects is a big problem. You know, just because you finish the cancer diagnosis doesn't mean you don't have lingering side effects. That could be neuropathy, that could be pain, that could be fatigue, anxiety, whatever it may be, but we're still here to support you through these side effects. It's not easy to be a cancer patient, let alone even a survivor, but that's why we're talking about today what we can do to try and help support you through this process. Monitoring your physical and emotional well-being is another thing that can be very, very helpful. Obviously, it's not just physical, effects that cancer and chemotherapy do cause. It's also physical, it's also emotional well-being. So we know that we have our amazing social work team. We have other resources here that can still assist you. Just because you're done with your treatment does not mean you don't have us here as support. And of course, staying on track with a healthy lifestyle, that's of course imperative to, ensure that you feel your best, putting your best foot forward. So what to expect at these follow-up appointments? Depending on the cancer, everyone is different in the sense of how often they do need to be seen. On average, patients do need to be seen every 3 to 6 months for the first couple years, and this might get spaced out over time, eventually becoming annually. And like I said before, it's very important that you do keep these follow-ups to ensure that we are preventing relapse. And if there is a concern, that we can further image you or do laboratory studies, listening to your physical exam, assessing you by physical exam, listening to your concerns, and as a patient, making sure that we're reviewing any new symptoms you may have or any new medications in general. Some patients will need recurrent imaging, and many patients will not need recurrent imaging depending on the diagnosis. So that's why it's important to talk to your doctor about this. Things that you should track and share with your provider. It's going to be important as a patient that you do ongoing track any new or new symptoms. Some of those symptoms could be fatigue, sleep issues, appetite changes, weight loss, worsening anxiety, depression, any side effects from ongoing treatments at all, or any new pain or discomfort. Any concern at all, you should always let us know. Like I said, we're still part of your team. We are your main aspect of your team no matter what. Even if you are done with your chemotherapy, you always have us to call, our nurses. We have wonderful nurse navigators. We have wonderful social workers, like I said. We have people that you can speak to. So if you have a concern as a survivor, it's important that you should still pick up the phone, give us a call, and let us be the ones to tell you not to worry about it, or let us bring you in to assess it and make sure it's not a concerning symptom. What are some good key questions to ask at your visit? Well, for patients, it's important to ask, well, what should I look out for? What types of signs or symptoms can I look for? Should I write down? Should I note? For example, someone with lymphoma, we might say, make sure you're not having any fevers, chills, drenching night sweats, unintentional weight loss, things like that. And this may be different for different cancers, but that's why it's important to discuss this with your provider. You should ask as a patient, what kind of tests or scans do I need and how often? Are there any long-term side effects that I should be concerned about or expect? Are there any healthy lifestyle changes that can help me stay well? Do I need any referrals for physical therapy, for mental health? Maybe you think that as a patient, you would benefit from some of these therapies. Those are things that you should discuss with your provider as a patient and someone that's been through chemotherapy or treatment in general. A survivorship care plan is just a lot of the things we've spoken about, but it's so you as a patient know what is your follow-up what is the follow-up schedule, what is the healthcare recommendations, maybe vaccines, maybe imaging, what is my diagnosis, what treatments have I had, what are possible long-term effects. It's important as you as a patient or as a survivor that you are aware of everything that you've been through, imaging wise, treatment wise, because your other doctors are going to want to know. And it is important that you are educated to know, these type of things. Have you been through radiation? Have you just had chemotherapy? Have you had any relapses? What was your most recent scan? Those type of things. So you should keep a well documented, notebook or journal and be up to date as you as the patient when you do go see your other doctors. So you do have all this information at your fingertips. Plus, it empowers you as in a patient to know, what your next steps are as well. This is just a little, I saw this chart and I thought it was quite interesting, but it just goes to show you that every cancer is so different. And, someone with head and neck cancer might have a total different follow-up than someone with breast cancer. So, like I said before, it is important to speak to your doctor, find out how often you do need imaging. This is just a little breakdown of, in general, how often patients need to be seen. But someone with testicular cancer might not need to be seen as frequently as someone with, breast cancer. So do talk to your physician. Do write down, the protocol of what they're planning on following for, let's say, the next year, 6 months, laboratory studies, imaging, so you know as a patient what to expect moving forward. And you can also let your family and other physicians know what the plan is moving forward because although you are a survivor, yes, the diagnosis is behind you, but it is something that you still need to stay up to date with and ensure that you remain on top of it, like I said, with follow-up visits. This is just, another point being how important your emotional and mental health support is. Remember, it's not easy going through cancer diagnosis. It's not easy mentally. It's not easy physically. It's not easy for patients' families as well. It's hard to be a caretaker. It's hard to be going through it yourself. But you do have us to always lean on. You have our team to lean on. And it's normal to feel these feelings of being anxious, sad, angry, numb. And we have lots of support options, like I've said. Speaking of before, I said some patients do experience neuropathy, for example, and we do have acupuncture. We have our social workers to speak to. We, of course, can refer you to psychiatrists if necessary, but we have support groups to speak to. So we do have lots of resources here to help you, and we are also always here to support you in any way. Some healthy living tips in general are just to eat a balanced, nutrient-rich diet, Try and stay as physically active as you can. I know after treatment, and this may be just radiation or chemotherapy, it's difficult to try and get back in a normal routine. But the best thing you can do for yourself is to try and put yourself back in a normal routine. Start small. Don't just go back to the gym 7 days a week, of course, but take walks every day. If you have to take breaks, do that. If you don't feel comfortable walking far from your house, walk in front of your house so that you know you're close by. Walk with a friend. But do start small and try and push yourself slowly because it's the best thing you can do for yourself physically as well as mentally. And if you are concerned, again, talk to your doctor or nurse practitioner about physical therapy or occupational therapy so we can at least help you to get started of feeling stronger and more confident. Try and avoid tobacco. Obviously, any type of tobacco in general is a no-no. Alcohol, listen, all in moderation, limit excess alcohol intake, but tobacco, really, you should obviously try and avoid. Prioritizing good sleep is, of course, ideal. So if you are having difficulty sleeping, I would document that and let your either primary care doctor know or at least your oncologist at a minimum to ensure that potentially someone can assist with your sleeping habits. And then lastly, managing stress with self-care and support, leaning on those that care about you. Speaking to those that you feel support you is imperative, of course, as well. Partnering with your primary care provider. You know, it's so common for patients that are going through a cancer diagnosis and do have an oncologist to say, "Well, can't you just follow me? You're my main doctor. I see you all the time." And that is true, and we're happy to still be a part of your care. And we do check a lot of laboratory studies, but unfortunately, most of the time we are not checking for diabetes or high cholesterol. And yes, we might mention if your blood pressure is high that you should go back to your primary doctor. We are not checking all the routine blood tests that a primary doctor should be checking every 6 to 12 months. So it is very important that you still do follow with your primary care doctor. They are an integral part of your team, and we're happy to communicate with them as well. We always try and share our notes and documentation with your primary care doctor, and we ask obviously for them to do the same. But it is important that your primary care doctor does know your cancer history, your treatment and follow-up plan, if there's any new health issues. So you do want to ensure that you do see your primary care doctor at least once a year, if not every 6 months, to make sure that everyone's on the same page and your normal healthcare maintenance isn't falling through the cracks because sometimes those things get put on the back burner when you are diagnosed with cancer, but you still need a bone density at a certain age. You still need cardiovascular screening, cholesterol screening. So it is important that you still follow up with your primary care provider to ensure those things are being checked. Going to the skin doctor once a year or every 6 months. We still want you to be up to date with all your healthcare maintenance to ensure something else isn't being missed. Final thought, you are a cancer survivor. Our goal is to try and make you to become feel that you're thriving. It takes time. It's not easy. Your life has changed as a cancer patient, but it is behind you at this time. As patients that are in remission, it also is behind them at this time. We see you as a survivor. Yes, technically at the 5 year mark, but patients have remissions, they have exacerbations, and no matter what, we want you to know that we're here to continue to support you. Your health journey matters. Be informed, stay involved, stay up to date with everything, and remember, you're not just surviving, you are thriving. That's it from my point. Is there any questions? Pull up the chat here.
Let's see. Don't see anything in the chat box. Q.
What helps feeling numb? If you're talking about neuropathy, if that's what you're asking for feeling numb, for neuropathy, there's things like acupuncture that can help. Not neuropathy, okay. Feeling numb in general, like going through the motions, emotionally. Yeah. It's very common side effect to be feel numb, almost like, you just can't accept what's happening. I would say lean on your family, lean on your friends, speak to our social worker. It is normal to feel numb, to feel like you don't feel sad, you don't feel angry, you're just going through the motions. It's very overwhelming when you have a new diagnosis of cancer in general or have been diagnosed with cancer. The best thing you can do is, like I said, try and get in a routine, stay active, lean on people you care about, don't isolate yourself. Do things you enjoy, which as simple as going to dinner with friends or, taking a walk outside, hanging out with grandchildren or children, doing things that make you feel feelings. But do reach out for help. Speak to our social workers, speak to your team. Maybe you need a medication, maybe you don't, maybe you just need talk therapy. But do lean on those people that are there for you. It's not easy. It is a scary feeling to feel numb, but no, you do have the support. Unfortunately, there's not an easy fix. Feeling anxious that the cancer will come back is a very common, very, very common feeling. And a lot of patients in general say that they live from scan to scan, which I know they say, it's potentially called scanxiety. A lot of patients have to get scans every 3 months, and that can be very fearful for patients to feel like almost you forget about it for a while, and then it's time for a scan again, and you have this absolute fear. The best thing I can tell you is to remember that you're doing everything possible by coming and seeing us every 3 months. The scans may be scary or the anxiety might be there, but know by you following up, if God forbid the cancer does come back, we are here to catch it early on in time because you're doing your part of following up appropriately. It's scary thought that you might have to go through what you did, prior. The odds are it's not going to come back. Yes, everyone's scenario is different. Everyone's cancer is different. But in this moment, you need to remember everything that you've been through. Remember how much support you had through it, and that although it might have been hard, you did do it, and you could do it again if you had to. Speak to your doctor though about these feelings. Ask them what are the percent that it comes back, how high of the likelihood it is to come back. When am I in the clear? When am I not in the clear? Those are good questions to ask your physician so you really know and can kind of, teach yourself and train yourself. Okay, there's only a 10% risk it's going to come back. I'm not going to sit here every day feeling anxious that my cancer may come back when there's only a 10% likelihood. Or maybe your likelihood is more likely or more common that it might come back. And well, I'm going to stay on top of it. I'm going to let them know if I feel anything out of the ordinary. I'm going to make sure I come to my appointments every 3 months. If they tell me to do an imaging or come in for labs, I'm going to make sure I'm compliant. I'm going to let them know any changes I feel, knowing that I am up to date with my care to ensure that if I do relapse, it's being caught very early. So it is a scary feeling, except that it is a normal feeling to be scared. It's normal to be anxious. Speak to your doctor, speak to social workers, speak to your family and friends about it. It is okay. Yes, the cancer's behind you, but I know it's always on your mind, and it's very normal to feel the way you're feeling. Any other questions? Hopefully that answered your guys' questions.
No, that was beautiful response. Anyone else? These are really good questions. Okay.
See anything else?
Thank you, Paige. That was amazing. And
Of course.
responses to the questions were very helpful, I'm sure, to everyone. And I want everyone to know that this lecture, as all of ours, are recorded. And so if you'd like to come back, look at it again, if you would like to share it with someone else that wasn't able to make it today, it will be ready in a few days. Today is Wednesday, so probably by the end of the week or the beginning of next week, we should have it available. And Lee will send you out an evaluation. So aside from responding to the evaluation, which helps us and helps our speaker, and allows us to add you to our database if you're not already on it. It's also the opportunity to request a copy of the link to this lecture, and Lee will be happy to send that to you. We'd like you to know, so this is the end of our presentations for June, and we have just one Zoom and Connect in July, which will be from our nutrition team. And the topic will be on gut health and it will be presented by our oncology clinical dietitian, Marie Mirande. So let's see, somebody made a comment, Paige. Can you see it?
Yes, yeah, I was just actually messaging back just to say
Okay.
stay positive. We're always here as a team to support you. I know not all doctors are as in tune with emotions as others are. Us nurse practitioners are usually very aware of the emotional side of things. So maybe speak to your nurse practitioner if you don't feel as comfortable speaking to your doctor about the emotional aspects. And remember, like I said, we always have our social work team here as well, which is that's all they do is work with our cancer patients. They're fully aware of the feelings you guys are going through. So don't feel shy to reach out to our team and ask for an appointment as well.
Well said. Thank you, Paige.
You're welcome.
And thank you for everyone that joined us today. This was a very worthwhile conversation to have, and we appreciate you joining us. Thank you, Paige.
Thank you,
Amazing
everyone.
as always. And bye, everyone. Have a great week, great summer.